What is your analysis of what the problem is and what, if anything, can be done to address it?
Yes, and thank you for having me. I think of this as the three Ds, if you will: doses, distribution, and demand. And we knew going into this that we were not going to have sufficient number of doses for everyone who needs a vaccine in this country. And there'd been some thought, high-level thought, about how to prioritize. But that was really done at very high levels, and the devil's really in the details about who you get these vaccines to. But where I think the problem is now is in the distribution. As Drew said, more than 13 million doses distributed, but only a third of those delivered. And I think this, as Drew said, this is really a lack of planning, a lack of federal resources, and personnel to deliver vaccines. Many countries around the world do mass vaccination campaigns. These are done for, childhood infections. And they do months of planning and work out what we call micro plans, where real details are worked out about how vaccines are going to be distributed and put in the arms of children. And we just didn't have that level of planning. We're trying to do it on the fly as the vaccines become available. And that, too, is one of the challenges. States just don't know how many vaccines they're going to get, and hospitals and nursing care facilities don't know how many vaccines they're going to get. So they're trying to do this on the fly. The third D is demand, and that's something that certainly we need to have, be sure that we can have the community's trust and acceptability of these vaccines, and that anything we do doesn't disrupt that demand.
Dr. Moss, let's focus on one of the things you mentioned, which is personnel. It's not just doing it on the fly, it's doing it at a time when our hospital, our healthcare system is under extreme stress from increased cases of COVID, increased hospitalizations. Do we have the people to do the inoculations when they're busy trying to keep people alive in ICUs?
No, you're exactly right. That's a really good point. Both the states and the healthcare facilities are overwhelmed, taking care of patients, doing the testing that needs to be done, and they just don't have the bandwidth to be administering vaccines. As in the United Kingdom, in India right now, they are training tens of thousands of people to deliver vaccines. That's what we should have been doing here in the United States months ago, just preparing the healthcare personnel to be able to administer vaccines.
How long would it take to get that situation corrected? We do have a new president coming in January 20th. He said this is his #1 priority, no doubt about it. He's put together a team, but as a practical matter, what is the lead time on training up the people to give the inoculations?
Yeah, I think it can be done pretty quickly, but it has to be done in a coordinated manner. We have to enlist the help of schools of nursing, medical schools, people who have some health training and have some experience. And I think within a couple weeks, we could train a large force to be able to administer vaccines. But again, it has to be done in a coordinated way with guidance, starting at the federal level, down to the state level, working with all of our healthcare institutions, as I said, schools of nursing, schools of medicine, to get large numbers of vaccinated trained.
Doctor, is this likely to get worse before it gets better in this specific sense? Right now we're talking about really administering this vaccine to healthcare workers and people in nursing homes. Those people actually have access to healthcare right now. What about when we go out to the general population, particularly some of the underserved parts of the population that don't regularly see a doctor anyway?
I think this is a really critical point. We will learn some of the logistics better. We'll have more vaccinators trained, but it's going harder as we move into, other high-risk groups, just identifying who those people are, setting the priorities for those individuals, which combination of comorbidities are going to put people higher in line, and really getting out to the communities. What is done in other countries in mass vaccination campaigns is they do outreach. They set up the vaccination centers in the communities so they can reach them. And I think we're going to need to do the same, but we just haven't had the planning, both at the federal and state level, to be able to do that yet.
Don't have the planning. How much of it's money? Are we going to need to appropriate a lot more money to get this done properly?
Well, it will require resources. It's going to require resources, financial resources, to set up these outreach vaccination facilities. It's going to require financial resources to have the personnel to administer the vaccines, to transport all the equipment and vaccines to these outreach centers. There's no doubt about it. The recent stimulus package has some funds to do this, but what the states have received thus far has been insufficient.
And finally, Doctor, how much of this can be done as a private-public partnership? President Trump was very proud of the fact that they got the Warp Speed project up and going. They did deliver vaccines in really record time. A lot of scientists were surprised they got the vaccines that fast. Is there some parallel thing that could be done in the public health administration here with public and private? Because I'm not sure if the federal government itself has the resources.
Yes, no, I think there is an important role for the private sector here, both in terms of administering vaccines, and we've already seen, the efforts by some of the pharmacies like CVS and Walmart, Walgreens to be able to administer vaccines. They do that already for many of our adult vaccines. But I also think private employers will play a role in vaccinating their workforce, much as we're seeing hospitals and healthcare facilities do that. I think we'll see an expansion of that going forward. So there is a critical role for private-public partnership in this mass vaccination effort.
Dr. Fauci said that he is looking for a time where we're going to be up to 1 million vaccinations a day. Is that realistic? Is that in the near future that we could accomplish that?
I think that can be accomplished, but it's going to take a lot of effort, and it's going to take resources and personnel, as we talked about. But other countries have shown that they can do that. They can vaccinate that number in a day, but it requires this high-level planning and coordination and the resources to be able to do it.